Hello and welcome to today's video. My name is Karl Connolly. I'm one of the founders at Netmaven. And at Netmaven we help channel partners embrace and monetize 5G solutions. Today I'm going to be joined by one of our partners, and that is Pixel Health. And Pixel Health are experts at healthcare IT consultancy, helping hospitals transform and embrace digital technology to increase patient outcomes. I have the pleasure of being joined by my friend Dr. Neil Kudler, who's the Chief Medical Officer at Pixel Health, and we're going to talk today about a blog that we're putting out this month in a series. And today's focus is all about the doctor, and more importantly, how 5G is helping doctors with improved efficiency, mobility, and helping them reach patients beyond the four walls of the hospital. So without further ado, let me introduce Neil and kick this off. Welcome, Neil.
Thank you, Carl. It's great to be here.
Okay, Neil, so the first question that I have for you is, it's very clear, obviously, that Pixel Health is a big advocate of the ability of 5G to increase collaboration. Can you think back to a time in your career where the limited access to data or remote consultancy had a negative impact on a patient's outcome?
Absolutely, Carl. In days gone by, when we had patients come into the emergency department with heart attacks, we would have to make the decision as to whether a cardiac angiogram would take place in that site where there were no surgeons for backup, or to ship them out across town in order to get the immediate intervention they required. If we had been able to transmit those dynamic angiogram images from one hospital setting to another, more rapid decisions could be made in terms of triaging that patient to surgery or to further localized intervention after those diagnostic films were performed. Having the power of 5G to transmit radiographic images, dynamic images in real time is something that is about time.
Now, Neil, Pixel Health has proven that access to 5G services is a great driver of efficiency because clinical mobility and collaboration gets a great boost. How does 5G access to clinical data, patient records, and 5G enabled tools drive efficiency and help the clinician spend more time with the patient and, more importantly, in front of the patient?
Yeah, a 5G environment would add tremendous efficiency to workflow. Imagine being able to carry devices that are on the network and able to recognize context geographically such that information is readily available based on the patient and your location. That kind of opportunity is made available with 5G technology because of access to patient information, the speed of the connectivity that enables that transfer of information, and the ability to latch on other technologies and tools to the 5G network.
Great, Neil. So I've got one more question for you, and I've just come back from Vive and HIMSS, both major healthcare conferences here in the US. And the talk of the town, or the talk of the show, was really about remote patient care and providing care to patients at home such that they don't even have to come to the hospital. Now, today, to get patient care in a remote location can be a challenge with the existing technologies. So what are some of those challenges that you're aware of? And then pivoting to 5G, how do you think 5G technology can improve patient access to care and, more importantly, improve patient outcomes?
That's a great question, Carl. We learned so much during the pandemic and about how important virtual care is. And we also learned how limited the resources are for many people in our community. The ability to provide a stable and secure network or video to a patient in their own home is truly critical for a therapeutic encounter to be successful. With limited connectivity or bandwidth where the communities are without, 5G can solve, a private 5G network can solve. So being able to offer that kind of access, not only to telemedicine, but to broader areas of care, including remote patient monitoring with 5G devices, can bring the care to people in their homes, both close to the health system, but more importantly, to those remote areas where they may not have clinical services in proximate regions.
All right, well, thank you, Dr. Neil, for being my guest today. And if you're a clinician watching this video and you're about to read the blog, I would highly encourage you to reach out to Pixel Health. They are experts in healthcare and speak your language and can help you understand how 5G can address the quadruple aim. And we'd love to engage with you. Go to www.pixelhealth.com for more information, or read the blog and reach out to the team for a consultation. Thanks a lot.